Welcome to Food Talk for Health, because you really are what you eat. Here is your host, Tonia King.
My guest today is Dr. Elizabeth Klodas, a statin intolerant expert and founder of Step One Foods. Thanks for joining me today.
Thanks so much for having me, Tonia.
A statin intolerance expert. Tell me about your complete area of expertise and what you're doing.
Yeah, so I'm a preventive cardiologist, so I'm mostly trying to put myself out of work. But my focus is really on lifestyle factors that, contribute to the development of atherosclerosis, this plaque buildup in heart arteries. And a lot of that is lifestyle related, especially nutrition related. And, the default right now is to just put people on pills, right? So high cholesterol, here's a pill, high blood pressure, here's 2 pills, without ever addressing why those conditions exist. And what I've come to understand and really appreciate is that unless you address the underlying cause, you're never going to cure anything. And so I see a lot of people that are, trying to really minimize their use of medications. That's why they're attracted to my practice. I prescribe drugs. I don't want to sound like I'm, a flake out there, just prescribing granola. But I do try to really emphasize the importance of how we live, because that is actually the thing that truly decides whether or not we're going to develop disease. And so I see a lot of patients that cannot tolerate statins, and that's why they're seeing me, because they need a different approach. It's not that it's necessarily a choice for them. It's they don't have a choice because they cannot take the medications because they feel so poorly on them.
Do you know how refreshing it is to hear that from a doctor? There are so many people that deal with these side effects. I know specifically somebody with diabetes, for example, that went on a pill and just got so sick from the side effects. And I'm sure the
Yeah.
same thing applies to statins as well, correct? You must have seen this with patients in order to really try to turn things around.
Yeah, for sure. And so the instance of statin intolerance, so really being unable to, tolerate any statin, so, any medication like Lipitor, Crestor, these are medications used to lower cholesterol, or, being able to tolerate a dose that's high enough to get you to your cholesterol goal is actually, not all that common. It's not everybody, right? The estimate is somewhere probably between 9 and 15% of people that are prescribed the medications can't tolerate them. But there's 94 million Americans with high cholesterol. So even if a small percentage of them, don't have a great experience on these drugs, I mean, that's a lot of
It
people.
is.
It's a lot of people.
Diet is key, wouldn't you say?
Absolutely. If you look at the causes of high cholesterol, so high LDL, the bad cholesterol that's it builds up in our heart arteries and is the part of the cholesterol profile that we focus in on the most. There are 3 main reasons why your LDL can be high, and all of these are affected by food. So the first one is you make too much. There's an enzyme in the liver called HMG-CoA reductase. Not that the name's that important, other than there's an enzyme in the liver that says make LDL, make LDL, make LDL. That enzyme is affected by multiple lifestyle factors. If you're inactive, if you're overweight, if your insulin levels are high, so if you're eating simple processed carbohydrates that drive up insulin levels, you're going to stimulate that enzyme and you're going to make LDL. There is there is a nadir, like genetic nadir, beyond which you can't get based upon, your genetic makeup. So no matter how how perfect your diet, no matter how much you exercise, no matter how skinny you are, at some point you're going to reach kind of the low point beyond which you can't get. Like, well, knock yourself out. Your body says, like, I like an LDL of 120. I don't care how much broccoli you eat. I don't care how many triathlons you participated. The good news is at that point, statins, which are HMG-CoA reductase inhibitors, they work on this enzyme. You won't need nearly as much, to get your LDL to goal, because you've just left one mechanism for them to, to have to overcome, which is your genetics, kind of your genetic predisposition. So typically you need pretty low doses of statins to get you to goal, which is really important in the context of statin intolerance, because statin intolerance is often dictated by dose. It's dose dependent. The higher the dose you have, the higher the likelihood that you will develop a side effect. So, okay, make too much. Number 2, get rid of too little. We have a natural elimination pathway for LDL, and that's related to making bile and digesting food. So you can think of a funnel of LDL coming to the liver that then turns it into bile and then dumps it into the digestive tract. And the bile is used to digest food, and it's used up in that process. Some of us are very efficient, and we reabsorb any bile that's not used up in the digestive process to have it ready for the next meal, which means that funnel of LDL coming back to the liver to make bile for the next meal doesn't need to be so big, right? So there's more LDL kind of left floating in the bloodstream, and your LDL levels go up. This is how the original cholesterol-lowering drugs worked. They were called bile acid resins or bile acid sequestrants, and they literally bound bile in the digestive system, and you eliminate through the stool, and it worked. LDL levels dropped. The problem was they were messy powders. You had to take 8 pills a day. People got digestive upset. So it wasn't very pleasant. It worked, but the experience wasn't stellar. So, when statins came along, these medications fell out of favor, but the mechanism that they leverage is still happening inside our bodies. And this is where food comes in again. This is where eating lots of fiber and plant-based foods that are loaded with plant sterols makes a big impact. So fiber works because we can't digest it. And so you have a fiber molecule, a bile molecule, bile molecules tries to digest it, can't do it. And before the bile kind of figures it out, like it's past the point of no return. So fiber binds bile in the digestive system, helps remove it, which helps lower LDL. Plant sterols are interesting because they're natural plant components that are actually the plant version of cholesterol, which sounds like bizarre. Like, why would you eat cholesterol to lower cholesterol? But what's interesting about plant sterols is that they're similar but different. They're similar enough that when they're in our digestive system, the body looks at them and says, like, oh, hey, you're like one of those bile guys I'm supposed to reabsorb. Like, here's your absorption site. Welcome back. You're really important. Well, the plant sterol shows up, and it's structurally just different enough that it can't get through. And it occupies kind of, keeps that absorption site busy, meaning bile behind it has one less doorway to get back in. And so you waste more bile and LDL levels drop. And this is why whole food vegans and vegetarians tend to have lower LDL levels than the rest of us. They're really leveraging this elimination pathway. Okay, final pathway, you use too little. So we use LDL cholesterol for all sorts of things in our body, to make hormones, to make cell walls, to make bile. But in order for that LDL to be used, we have to bring it inside cells. So we need a receptor to kind of grab the LDL from the bloodstream and bring it internally. That receptor is genetically driven as well. There's an enzyme, PCSK9, that regulates receptor activity, and this is where the latest cholesterol-lowering drugs work. They work through this enzyme that regulates LDL receptor activity. So Repatha, these injectables, right? Leqvio, these are biologics that work on PCSK9 and affect LDL receptors. But from a food perspective, Saturated fats. Saturated fats downregulate LDL receptors, meaning when you eat a fatty meal, eat saturated fats. These are fats that are solid at room temperature. They come primarily from animal sources. So butter, cheese, the marbling in beef, the fat in chicken, they cause those LDL receptors to kind of get lazy. And so LDL levels stay up. LDL, because LDL is not being taken inside cells. This is why someone on a keto diet, which can be very high in saturated fats, you can see their LDL levels go through the roof. Now, not everybody, right? Like, we're all genetically distinct. These three different mechanisms are variable inside each of us, but every single one is affected by food. By the way, unsaturated fats that are liquid at room temperature, actually upregulate LDL receptors. So people who eat, fats more from the olive oil, nuts and seeds, avocado, fish category, tend to have better cholesterol profiles. One interesting thing, and this will help explain why LDL can sometimes change around menopause, is estrogen affects LDL receptor activity. So when we're young, we have lots of estrogen and our LDL receptors are on fire. They're just grabbing LDL everywhere. And then when we go through menopause, that protection is gone, and our LDL receptors go, where's my estrogen? And so it's not unusual to see LDL levels go up in women as they go through menopause, even though their weight may be exactly the same, their exercise, their, diet, nothing's changed, but their LDL all of a sudden went up. It's the estrogen.
How do people know if they are statin intolerant?
It's something people will see either on a lab test or how they feel. So the most common side effect of statins is muscle achiness. And this tends to affect large muscle groups, tends to be symmetrical. So shoulders, back, legs, one sore finger is very unlikely to be a statin side effect. And these tend to come on, within the first 6 months of being on therapy. If you've been on statins for a year and you haven't experienced any unusual achiness, chances that you develop this side effect from statins is pretty low. And again, the vast majority of people tolerate these drugs great. They just take them, they feel nothing, and their cholesterol levels improve. But if you're going to have a side effects, muscle achiness is the most likely. It's sometimes hard, right? Getting your whole act together, and you've started also an exercise program, and now you're sore. Well, is it the statin, or is it the fact that you just started strengthening program? And so sometimes it can be a little bit difficult, to decide. So we stop the medication, restart, stop, restart, make sure that in fact it is related to the drug. It typically goes away when you stop the medication. So it's a reversible side effect, but it's unpleasant, right? And it can really vary in terms of intensity. Some people just notice it takes them longer to recover from, an exercise, a run or something. Other people can't get out of bed because they're so sore. And so, the last thing we want is for a medication to interfere with someone's ability to exercise. Like, that's not a good trade-off.
Right.
So muscle achiness. Number 2 is liver function abnormality. So this would be a lab test. You won't feel this, but remember the statins work on HMG-CoA reductase, which is an enzyme in the liver. So these medications work in the liver, and they're just supposed to target that one enzyme, but sometimes they have a broader effect and kind of rev up the liver in general. And we see this with elevations in liver function levels. And so when we start people on statins, we typically, up to the point where we get them to their, sort of stable dose, we'll be checking their liver function tests as we check their cholesterol profile. This is something that happens very early. If you're going to have a liver issue, it'll show up on the first blood test. So it's not something where you're on these drugs for 5 years and then we go like, oops, sorry about your liver. And again, it goes away when you stop the medication. Another one is, and this is something you might feel very rare, but I have seen it, is people experience a change in their cognitive function. They just get less sharp. And, like you used to be able to, add up whole columns of numbers in your head. You can't do that anymore. Again, reversible when you stop the medication. If you look at the long-term data, statins are actually protective against dementia, probably because they also reduce the, not just reduce the risk of heart attacks, but also reduce the risk of these tiny micro strokes that we don't necessarily might not notice, but one too many, and you don't know where you are. So they're long-term protective. The one that's probably most disturbing is the fact that they're associated with an increased risk of diabetes in the long haul. And so it's a small risk, and the consensus is that the protection and the risk benefit of being on statins far outweighs the risk of developing diabetes. But that risk is not zero. And so, and you don't take statins like an antibiotic for 2 weeks and you're done. The idea is you take them, once prescribed, you take them for the rest of your life, because presumably you need them, right? Because you haven't been able to manage your cholesterol any other way. And so, that's a big deal, right? People go on these drugs, not, like I said, not for a couple of weeks, but for several decades. And so if you're increasing your risk of diabetes over that time, that's not a small thing, which is why it's still important to eat in a way that is health promoting, to keep weight down, to exercise, right? Being put on a pill does not obviate the need to attend to all lifestyle factors, because there's way more to health than an LDL number.
That's so true. And I'm wondering, people that get put on these drugs, whether it be for cholesterol control or diabetes or whatever,
Yeah.
can you just stop taking them cold turkey and then try to revert to a diet plan to work?
Yeah. So you don't become addicted to them. So you don't have to, taper or anything like that. You can stop them cold turkey. However, not everybody should, right? There are some people who should be on these drugs because, why do we put people on these medications? Well, it's not to make cholesterol numbers perfect. It's to reduce risk. Right. And there are people who clearly benefit from a risk reduction perspective by being on these medications. The first one, probably one of the largest groups, is people with known heart or vascular disease. So if you've already had a stroke, a stent, a heart attack, bypass surgery, you should be on statins like that, and there's no controversy there at all. That's part of the standard treatment. It is protective. People do better when they're on statins if they already have established coronary or vascular disease. Number two is diabetics. So people with who are between ages of 40 and 70 actually do better being on statins, because the number one reason why diabetics die is heart disease, heart and vascular disease. That's what kills diabetics. It's not the blood sugar, it's the atherosclerotic disease that's accelerated by abnormal blood sugar level. Giving extra protection through statins and cholesterol reductions can really help with outcomes in that group. The final group is people with familial hypercholesterolemia. So these are individuals, and they're rare, relatively speaking, but these are people with sky high LDL or bad cholesterol levels, like typically over 200. And those individuals, they can't, reduce their LDL through lifestyle. It's just high. And all of these risk factors are cumulative, right? So the earlier we get the LDL level reduced, the lower the risk of atherosclerosis down the road. Again, another group in which this has been proven. However, so those are three groups, no controversy. However, most people are put on statins because their numbers are put into a risk calculator, and it spits out a number and says, like, well, your risk is 7.5% over the next 10 years that you're going to have a cardiovascular event. Well, here you go. The guidelines saying go on a statin. Well, that's a lot of people. And, like I said, there's 94 million Americans with high cholesterol. Like, really? We should be putting all of these people on statins? Like, that just doesn't make sense to me. We don't have high cholesterol because of a deficiency of statins. We have a high cholesterol because of a deficiency of the right foods. I mean, we just spent time talking about how food influences every major pathway in cholesterol control. Like, shouldn't we try that first?
Well, that brings up a point because many times people go to the doctor and let's say they get blood work done and the doctor immediately looks at their numbers and the first thing, prescribe a pill instead of maybe talking about, well, what's your diet? What's your lifestyle? That's the stuff that drives me crazy. Like, why aren't more doctors looking at that first?
Well, many, many reasons. Some of them are related to our training. We receive no training or minimal training in nutrition, which is educational malpractice.
Yeah.
What I treat as the downstream effects of poor diet. Number two, the system is geared towards medications. It just is. The visits are short. You've got a problem. The guidelines say put people on statins. That's just, it's kind of what you do. That doesn't mean it's right.
Right. It's just been
customary. It's just customary. And, to some extent, a lot of, patients also have that expectation, right? People also want the easy way out. Okay, I'll just take a pill. Good, done.
Right.
And but that doesn't breed health. And, the statistics, I think underscore that. I mean, heart disease has been our number one killer since those statistics have been kept, with the exception of a couple of world wars. It is the number one reason why Americans die. Even during the COVID epidemic, it was the number one reason Americans died. It was due to heart and vascular disease. And this is, again, this is a condition that need not exist. 80% of heart disease is preventable. Like, why is it our number one killer? It's because we're treating the wrong thing.
We are talking with Dr. Elizabeth Klodas. Now, you have come up with something interesting. You've developed Step 1 foods. Tell us about that.
Yeah, so Step 1 foods kind of arose out of this entire frustration with how we approach the management of cholesterol. I did do like a whole effort on teaching people what they needed to do, et cetera. But what I realized was to eat in a way that affects cholesterol, it's hard. It takes a lot of effort. You have to know what you're doing. It's not just about eating, the right nutrients. It's got to be the right nutrients in the right amounts. Like, how much fiber, how many plant sterols, right? What about the, unsaturated fats? What kind? So the whole idea behind Step 1 foods was to make this easy. And, it kind of like, instead of, asking people to take 2 doses of drugs a day to control their cholesterol, well, how about if we just do 2 doses of food? Like, that's it. And that food just happens to be, specifically formulated to deliver the important nutrients that affect cholesterol, cholesterol metabolism in concentrated ways, and doesn't try to take over your life, right? I'm not going to ask you to become a vegan. I'm not going to ask you to start running triathlons, right? Like, just do this. Just eat two servings of food a day, 2 dose servings, and it's a bar and maybe pancakes in the morning or something. Like, it's already stuff you're eating. They've just been formulated in a way to impact cholesterol. And what we have found is that in 30 days, you can see meaningful cholesterol reductions. We did a trial with Mayo Clinic and University of Manitoba, randomized controlled clinical trial. In the same type of study you would subject pharmaceuticals to prove that they work. And we found that in 30 days, on average, we could reduce LDL cholesterol by 9%. Now, 9%, maybe that doesn't sound like a huge amount, but if I reduce the average LDL of the US population by 9%, I would finally dethrone heart disease as our number one killer. From a population perspective, it is a humongous impact. What was more, to me, because I treat individual patients, not, the entirety of the population of the United States, but individual people, and I see individuals who cannot tolerate these medications or refuse to go on them, or they're not a goal despite maximum tolerated doses, is there were people in this trial that had 20, 30, close to 40% LDL reductions in 30 days with food.
That's amazing.
right? Medication level responses. And so the way I have been using these foods in my own practice is, number one, well, let's just try. It's going to take 30 days to find out whether or not you are a quote unquote food responder. And if we see some movement, okay, let's let's hit this, because you are someone in whom we can, keep iterating here on your nutrition and see how far we can get. If I see no response and the person says, like, I did it, I really did, like, I use this twice a day, just like you told me, and we see very little change or nothing, it's like, okay, this is unlikely that pushing diet is going to have this miracle effect we're hoping for in your cholesterol profile. That doesn't mean diet isn't important. It doesn't mean exercise is important. Like, we are still going to do that, but maybe we're going to lean into medications earlier, because it's, this is the thing we have that will impact it. Maybe, this is more genetically driven, and that, we see
Everyone's different, right?
Everybody's different. But I would tell you, 80% of people in the trial had some response. And so that says, okay, like,
yeah, it's encouraging.
It's encouraging. And it doesn't take long to figure out. It's not like you have to, like I said, commit to giant dietary change or do something for 6 months or a year. It's like 30 days.
Well, so tell me a little bit about what is in some of these products.
Yeah, so there's 10 products overall, and they're all interchangeable in terms of nutrients of interest. So there's 5 different bars, there's 2 different oatmeals, instant oatmeals, there's a little sprinkle, which is like a raw ground granola you could put on yogurt, there's a pancake mix, a smoothie mix. So again, kind of breakfast and snack oriented. But what they all deliver, and this is based upon whole real foods, the only fortification being plant sterols, because it's very difficult to get to the levels of plant sterols needed to impact cholesterol through 2 servings of food, right? You really would have to be a whole food vegan, right? So the 2 servings of food deliver at least 10 grams of whole food fiber. So it's fiber from real food. It's not that we've added a bunch of inulin or something to the food. It's like, no, it comes from oat bran and chia and flax, right? From whole real ingredients. There's at least 2 grams of omega-3 fatty acids from that plant-based unsaturated world. So again, fats that are increasing your LDL receptor responsiveness and activity, and they're very low or absent in saturated fats, so we're not adding ingredients that are down regulating those LDL receptors. We have plant sterols, at least 2 grams of plant sterols in 2 servings. So again, between the fiber and plant sterols, we're really leveraging that elimination pathway. And then finally, all of the foods are made with complex, whole, real, plant-based ingredients, so they're very complex. And so when you're digesting them, you're not causing these big sugar spikes, and you're not driving insulin up, so you're not stimulating that HMG-CoA reductase. So it's really a multifactorial effect based upon, whole real foods. Again, we know what to eat. We actually know what to eat. I did not invent.
So here's my question. Does it taste good? Well, okay. So I'm the inventor. I love these foods. I think they taste amazing. We have used, the highest quality ingredients. I mean, 72% cacao, dark chocolate, is if it's chocolate, that's what it is. I mean, walnuts, almonds, just the best. We have sourced everything to make sure it tastes the best to begin with, and then we combine those ingredients together. The foods taste great. If you are used to highly processed, sugary, foods that are flavored, sugared, whatever, this will taste different. This is whole, real food. But this is what food is supposed to taste like, and it's delicious. It's delicious. These are going to be less sweet than what people are used to, but it doesn't take long to get to adjust to the
the sweetness level. And what I would tell you is people say like, it took me a couple of weeks, but now I don't like the other stuff because it's way too sweet.
So, all right, here's another question.
Yeah.
What if I don't know if I'm high in cholesterol? Can I still enjoy the step one foods as a kind of preventative maintenance type of deal?
Oh, yeah. So, if you're doing this for cholesterol, right? If this is a food intervention that you want to try, I would encourage you to have a before, right? So, which could be within the last 6 months or so, assuming not much has changed with your health, right? Have a baseline, do this for at least 30 days and and kind of before you run out of food, get your cholesterol rechecked, right? So
Right.
that would be sort of the scientific way we'd approach this. Is the same way we'd approach medications. We wouldn't just have to take a medication on faith, like
Right.
check, did it work? Okay. But if you're, the beauty of this is it's food, and it's just, and it is nutritionally dense, health promoting food. Because here's the thing, if you're eating right for cholesterol, like unlike statins, which are, one hit wonders, you take a pill and your cholesterol is better. But what else have you done? Nothing. You've done nothing for your blood pressure. You may have actually worsened your blood sugar control, right? Your weight's the
Right.
same. Well, if you eat right for cholesterol, you're also eating right to lower blood pressure, to improve blood sugar control, to lose weight, actually to support, a healthy dietary intake that also, reduces your risk of cancer, reduces your risk of dementia. And I'm not here to say, that this is, this food
It's not the magic bar.
is not the magic bar, but as part of your comprehensive efforts, these foods are supremely safe. They are going to fit in with what you are trying to do, because regardless of what the question is, right? Like, or what the goal is, like, I want to prevent dementia. I don't want to get cancer. I don't want to get, digestive problems. I want to reduce my joint swelling and arthritis symptoms. Like, the answer is the same. It's a whole food, plant-based diet, and these fit right in.
We are talking with Dr. Elizabeth Klodas. Fascinating information. Where can we go for more details online, and how do we find you on social media?
Yeah, so the best way to find us is on our website, which is step1foods.com. You can find out more about the Mayo Clinic and University of Manitoba study there. You can find out more about the products themselves and the science behind them. And, every single week I write a blog. I am, this is not just about, making people buy product. Like, that's not it. It's really about helping people, become better stewards of their own health. And that's just not through diet alone. It's also through information. Information is power. You need to know, like, all the things you can do yourself to help improve blood pressure readings, or to, what you need to do to, avoid osteoporosis, or, things like that. So I write educational content every week, and we get a lot of comments from our customers say, like, wow, I learned a lot.
Knowledge is power, for sure. Dr.
Sure.
Klodas, it's really been a pleasure chatting with you. Thank you so much for your time.
Thank you so much for having me. Enjoyed it, Tonia. Thanks.
You've been listening to Food Talk for Health with Tonia King. Thanks for joining us. Eat well to be well.